Lauren is very dramatic. She's very fun-loving. She's funny. She's very humorous.
I like to do crafts, and I like to paint, and I like to go on YouTube.
Always finds something positive out of every day.
She's also just a very sweet, caring person to talk to, and you get a sense that she cares about what's going on around her.
She's a lot of fun. She had been at school and there were some other kids that were sick, and she had gotten sick.
I got all dizzy, so I went to the nurse, and then after that, the nurse told me to lay down, and I ended up falling asleep, and I almost missed a bus.
She came down with, your typical symptoms of a cold, cough, sneeze, sore throat, and had a fever. And then the following morning, she came downstairs, and her eyes were fixed toward her nose.
If I looked at my mom, I would see that she had 2 faces with 4 eyeballs, 2 noses, 2 mouths, and probably like 100 teeth.
She was extremely scared, crying, what's wrong with me? Why can't I see right? Why am I dizzy and sick to my stomach? It stayed like that for a number of hours, and then it stopped, and then it would be just one, and the one eye would just drift back and forth and back and forth. So that was scary for all of us because nobody knew at that point exactly what it was.
When I had to do one of those timer reading tests, I would be like the slowest one. I would only get past like 3 sentences in a minute. It made me feel like I was the only one in the world who had this sickness.
So I had taken her up to the doctor after, she had been sick a couple of days. At first he thought it was seizure related, and then they ruled that out, and he wanted her to see a specialist.
When I first met Lauren and heard her story, the most striking thing to me was that it was a little atypical. I see a lot of children with eyes that cross and eye misalignment, and at her age, it's a little less likely for it to just come on all of a sudden. Because of that, and with her being otherwise healthy, but with some kind of vague symptoms of some stomach bug, she had a headache, and with a double vision, I felt that was enough to warrant further workup rather than just chalk it up as a childhood misalignment. Part of it maybe because she was so articulate and able to describe her symptoms of double, but it was very clear that this was not normal. And at her age, I was worried about her suppressing vision in one eye. The double vision was actually a good thing. That meant that she wanted to use both eyes, but if she started to suppress vision in one eye, then it could become a permanent form of vision loss. She's a little bit older for that to happen, but it was still possible. It's also an important time during her life when she's developing binocular or 3-dimensional vision, and with the eyes crossing, if it became more frequent, she could start to lose that potential permanently.
So they called and said, we need to have her come in and have the surgery done.
And the day she told me that we are having surgery, that scared me a lot.
The day of surgery, my husband and I and Lauren, we went into the Outpatient Surgery Center.
The day of surgery, the patients arrive at the Outpatient Surgery Center and are greeted by one of the people at the front desk who brings them back to the preoperative area. There is a little play area for children there, which in my experience puts them at ease. There's toys and anything that makes it feel more normal for them.
I took my monkey, his diaper bag with all his diapers, and then we walked in, and then I did all the paperwork, and then when they asked if I had insurance, I got stuck on that, and then Mom had to answer that one.
They made her feel special. It was kind of like it was her day.
She seemed comfortable. She seemed at ease. The nurses there are wonderful working with children, I find, of all ages, and she didn't seem overly stressed to me. I was a little worried because of her being kind of sensitive, but I found that she did take charge of the situation. She asked the questions, very appropriate questions. If in many ways, I think she asked more pointed and appropriate questions than a lot of adults.
It was really nice.
They made me put on a special pair of pajama pants, and after that, I got only like 5 minutes to go into the weigh room.
We went from her cubicle into the OR.
Lauren came into the operating room. She was accompanied by her mother, and so they were prepared that she was going to have a mask over her face to help put her to sleep. She had decorated it beforehand, which she seemed to love, and she's artistic, and it looked beautiful.
They said I can't put any stickers like right here or right here because they're going to hook up a tube. So I decorated these with like heart stickers and flowers, different hearts and crayon stickers. And then they got me my own heated blanket, and it was so warm.
So she had her mask that she had decorated. Mom was right there by her side. Anesthesia spoke to her about, we're going to hold the mask. She did that, no problem. And even though there's a lot of people in the room wearing blue garb, everyone kind of introduced themselves, and so she seemed pretty, again, at ease at that time. She went to sleep, no problem, and at that point, Mom was able to give her a kiss on the cheek and left the room and told her I'd talk to her right after the surgery. At that point, anesthesia takes over as far as keeping her safe, intubated, and ready for my part of the procedure.
She wasn't scared at all. That was the important thing.
It felt like I was only asleep for a second, and then I woke up and I was all like oozy.
As soon as she said, I have pain, immediately she got pain medicine and it was gone, almost immediately. It was a great experience.
Lauren's prognosis is very good because we still are a little unclear as to the underlying cause of crossing in all kids. It's hard to predict long-term what to expect, but she had a great outcome initially. She's maintained good straight eyes. She has that benefit of good binocular vision to help keep her eyes straight, and everything else about her eye exam is normal. So there's a very good chance that she'll have good single vision for a very long time.
From a parent's point of view, I have to tell you that my experience, my husband's experience, we were so impressed to feel comfortable to take our daughter down to have the surgery.
The Outpatient Surgery Center is an ideal location for, I think, both the surgeon and the patient. It's comfortable, it's an easy place to come in and out. The nursing staff is all accustomed to working with this type of patient, and it's a top-notch facility as far as the equipment available, the quality of care provided, the follow-up for the patients. They always call them the next day, and I feel like that attention to detail and to the patient experience is what makes it such a great place to work and to receive care.
For anything that I would need to have done, I would definitely have done there.
I'd probably say that it was the best thing that ever happened to me because it fixed my eyes, and if I never had that, I would never be normal again.